So today, Haley, me, and I will be talking about kidney stones. So first, just a quick overview of what kidney stones are. They are hard deposits that form in the kidneys from concentrated urine and salts. And usually as the stone passes, as you can see over here, this is the kidney. As the stone passes into the ureters, this is when people experience the most pain because it is a small tube. And then it will travel into the bladder and hopefully get excreted out in the urine. Sometimes this doesn't happen and other interventions will have to take place, and we'll discuss those later. Depending on the size of the stone, the symptoms can range anywhere from mild to severe. So the bigger the stone is, the more severe the pain is typically.
There is no definite single cause of kidney stones, although several factors may increase your risk. Diet, excess body weight, certain medical conditions, and some supplements and medications may increase your risk of developing kidney stones. Certain foods may increase the chances of having kidney stones in people who are more likely to develop them, such as overweight people or people with existing medical conditions. Urine may lack substances that prevent crystals from sticking together. This creates an ideal environment for stones to form. Kidney stones form when your urine contains more crystal-forming substance, including calcium, oxalate, and uric acid.
So now I'll be discussing the mechanism behind kidney stones and how they're developed. So kidney stones typically form when urine is concentrated with crystal-forming substances such as calcium oxalate, uric acid, phosphates, cysteine, and xanthine. When the urine becomes too concentrated, these substances will become crystals and start to adhere to others to form a stone. So once these crystals form, they adhere to one another and they become bigger and bigger. Also, like what Haley said, when the urine is lacking citrate salts, they bind to calcium and dissolve it. This will increase the likelihood of stones forming from calcium crystals. And kidney stones usually start small and they grow larger and larger. The signs and symptoms associated with kidney stones are severe sharp pain in the lower back. It usually radiates from the abdomen and groin as well. And the pain happens periodically and it fluctuates in intensity because as the stone moves from the kidney to the ureters into the bladder and then eventually is excreted in the urine, hopefully without surgical intervention, the pain as it's moving to a smaller location like the ureters, it's going to increase the pain. And usually you have a burning sensation during urination because your urine is so concentrated, and the urine characteristics are brown, pink, red, bloody, or foul odor. It's these colors because there can sometimes be blood in the urine from the stone passing from the kidney to the ureters to the bladder. It's also associated with nausea and vomiting, fever and chills, and frequent urination because you feel like you can't empty your bladder because the stone could be blocking it. And a kidney stone usually will not cause symptoms until it moves around within your kidney or passes into your ureters. So if it's just sitting in the kidney, you usually won't experience many symptoms.
There are several risk factors involved in developing kidney stones throughout your life. Family or personal history is a major risk factor because you're more likely to develop kidney stones if someone in your family has or has had them in the past. Dehydration also plays a major role in your risk of developing kidney stones, especially people who live in warm, dry climates and those who sweat a lot. Certain diets also play a major role in developing kidney stones. Too much salt in your diet increases the amount of calcium your kidneys must filter and significantly increases your risk of developing them later in life. Obesity, increased body mass index, large waist size, and weight gain have all been linked to an increased risk of kidney stones. Digestive disease and surgery also play a major role in developing kidney stones throughout your life. Changes in the digestive process that affect your absorption of calcium and water increases the amount of stone-forming substances in your urine. Medical conditions such as renal tubular acidosis, cytopenia, and repeated urinary tract infections also can increase your risk of kidney stones. Certain medication and supplements, such as vitamin C, dietary supplements, laxatives, calcium-based antacids, and certain medications used to treat migraines or depression can increase your risk of kidney stones. It is important to maintain a healthy body weight and fuel your body with proper nutrition and hydration to decrease your risk of developing kidney stones throughout your life. In order to get a diagnosis for kidney stones, your doctor may run a few of these diagnostic tests. One would be blood testing, and this is going to reveal if there's too much calcium or uric acid in the blood. Another would be urine testing, and this is going to show if there are too many stone-forming minerals or too few stone-preventing substances in the urine. Another test could be imaging, such as using an X-ray to show if there are kidneys already in the urinary tract. Another way would be to analyze past stones. And this is going to show the makeup of the kidney stone, which will help the doctor determine what is causing these kidney stones and if there's any way to prevent more from happening. In order to treat kidney stones, some simple lifestyle changes will have to occur in order to treat them, such as making sure you're drinking water throughout the day, eating things that contain low salt, trying to stay away from low animal proteins, along with making sure to eat high calcium rich foods. As far as medication goes, some simple pain relievers such as Aleve and Advil can be suggested, along with being prescribed calcium stones, which will reduce calcium stones in the urinary tract, and also uric acid stones, which will help reduce the uric acid levels in the blood and urine. Now, if the kidney stones that are occurring are large, some procedures can take place, such as an ESWL, which are sound waves that will create a vibration that breaks the stone into tiny pieces, which will make it easier to pass through the urine. Another is surgery to remove the kidney stones, or a doctor can also use a scope to enter through the urinary tract and retrieve the kidney stone. As far as the prognosis goes, it is overall not life-threatening unless an infection in the kidney were to occur. And there is always a chance kidney stones can come back if not treated properly.